It's okay.
So, hi everyone, it's Dr. Nonnie here. I'm a GP and I'm also a mother as well, for those of you who are new to my channel. And the topic I'm going to be talking about today is breastfeeding, the benefits of breastfeeding. I really think it's such an important thing that you can do as a mom for your child. I know not everyone does breastfeed, but I'm just putting it out there, just some information for those of you who may want to. And I have a very passionate speaker about breastfeeding, and she's going to be joining us today all the way. I have to say this, my first American guest, yes, and she's Miss Ifeoma Echeazu. So Ifeoma is a public health, has a master's in public health, and she's also done some work working with women about their breastfeeding decisions or not to breastfeed. She's had lots of experience just speaking to them and from their, just heart to heart and hearing how they feel. And so, Ify, welcome to the show. It's very nice to have
Thank
you here.
you.
Yes. So, I mean, from your work that you've done with these ladies, would you say that breastfeeding is, ancient and something that we used to do in the olden days, or do you think it's something that we should still be aspiring for today? What do you say?
Um, well, breastfeeding is nothing new, so it's something that we've been doing for decades, centuries, etc. Is it something that has switched where we're not doing it as often? Yes. Should we be doing it? Yes, to answer those questions. So, and I think we'll get into the whys.
So, I mean, so your summary is that we're starting off with saying that we think it's something that we should still be doing. It's not something that we should say it's old fashioned. And so, why? Why do you say that? Why say you?
So, um, I think it's important to really just talk about first why, right? Why do we think it's important to breastfeed, and why are people not even breastfeeding now? Formula came into the U.S. I think, don't quote me now. It had to be either the 60s or the 70s, I believe, and so we saw a switch, especially with women. Getting into the working class, or like we get into work and things like that. But overall, women were breastfeeding just because there was no other option, right? So at the time, you just breastfeed because your body creates milk for your baby, like food to sustain life, and so you breastfeed. People breastfeed all over the world. But once formula came in, there was a shift. So breastfeeding comes with a lot of benefits, and I guess I'll just get right into it, right? If that's okay.
Yeah, yeah, yeah. Why?
So yeah, so there are so many benefits for breastfeeding, and oftentimes people think like, oh, breastfeeding, the benefits only, are for the baby, which is important, but it's not. There are the benefits for the baby, but then there are also benefits for the mom. And so to start with the child, so yes, breastfed infants typically have a reduced risk of asthma, obesity, type
Mhm.
1 diabetes. They lower their respiratory, ability to, or to get or lower risk to get respiratory illnesses. Um, Gastro infections, things like that, reduced risk of SIDS, so sudden infant death syndrome, which we don't
Mhm.
still do not know the cause of today, but we know that are things that can either increase. So, for example, feeding formula does increase a child's risk of getting SIDS, and then you see breastfeeding, which is on the other end, which decreases that risk. So, breastfed infants have a reduced risk of SIDS and necrotizing enterocolitis, which is really for premature babies, and that's when part of the intestine, the walls or the dies off. So at that point, premature babies will have to get surgery to have it removed because it starts to like to the part of the intestine dies off, and they have to do this whole surgery to be able to basically combine or bring the bowels back together. And so we know that breastfeeding reduces that risk of premature babies having to go through that. So there are just all these benefits of like, oh yes, it's good for, it has the fat content, the calorie content. It's always at the room temperature, the right temperature for the baby. And one
Mhm.
interesting fact that people don't know, or some people know, but some I've noticed that some people don't know, is that every time you latch your baby onto your breast milk changes according to what that baby needs, because what happens is the saliva from your baby back washes up into the nipple and it communicates and it lets the baby know. So let's say the baby's sick. Let's say at the time the baby is having a cold. Your milk, you will notice your milk will change. So the level of fat content and all of that will change. It won't look the same as yesterday. So
Mhm.
all these great things, right? So yes, woo for baby. Okay, what about What about for mom? And so for mom, there are benefits too. So mothers who breastfeed are at reduced risk of high blood pressure. They're also at a reduced risk of type 2 diabetes, reduced risk of ovarian cancer and breast cancer. And so when I say breast cancer, I do want to tread lightly because I don't mean the breast cancer that's associated with the BRCA gene, because that's genetics. And so that does not count for that. So we're talking about, after having a baby, you have this increased risk. So breastfeeding reduces that risk. So there are different benefits for mom and different benefits for baby. And I do want to make this disclaimer too, that it's all about, yes, we want to give people the facts and we want to let them know breastfeeding is beneficial. This is why you should breastfeed. But it's really giving you these facts and these tools so you can make a decision that's best for you. There are women who do use formula, and that's fine. There's not, because they're in this world, like especially on the internet, I've seen a lot. They're the breastfeeding moms, and then the formula moms, they're like, it's okay. You made that decision that's best for you. Breastfeeding moms made a decision that's best for them. It shouldn't, we're all about supporting and uplifting women and each other. So there's nothing with that, but we do want you to make an informed decision, knowing the facts. Are there benefits to formula feeding? In that sense, health benefits, no, there are not. And so it's just, that is just the fact. And so it's not about making one to feel bad. We're all supporting each other in this decision. I could go on and on because there are other benefits like cost, which is the big one. So I did a lot of, when I did my work in Michigan, I worked in the Women's, Infants, and Children's program for 2 years. And so I did focus groups with moms, and I did focus groups with dads too, and partners. But one thing so when I talked to them, I asked them, whether they wanted to breastfeed, whether they were interested. A lot of them were pregnant. And so, or all of them were pregnant for the groups when I did the classes. And we asked them, oh, what do you know about breastfeeding? Do you want to breastfeed? And so the women who have breastfed before were like, I want to breastfeed because I'm not paying for formula. I was like, I understand. Breastfeeding is free. You don't have to pay for
Definitely.
anything.
I didn't pay for formula too. Not at the start.
Exactly.
Yes.
Exactly. For a lot of women, that's a motivating factor, is being able to not to say, like, I don't have to come out of pocket all this money, because formula is kind of expensive. I think one can, don't quote me, costs like 24, 25 US dollars. And so imagine, and that might be the small regular can. There are larger cans, and just having to do that, you have to have bottles, you have to mix the rights, with filtered water and the temperature and all of that. And it comes with so much more. And so that's also a motivating factor for women too, is that it's free. I don't have to pay for it, and it's always there as long as you take it out. It works like a factory. When you remove, you make. Once you remove, you make. So if you're not doing that, then that's where some issues can come in. But yeah.
Wow, I think Erin, I really enjoyed listening to you. For once, I haven't interrupted a guest, so well done. You shared so much good stuff, and you made it so real for our moms. So I think, as you've said, it's not a case of where saying, if you want to use the formula, it is your choice. But I think what we need to do is to encourage women that, look, people are still breastfeeding. I have three, and they were all breastfed. In fact, they were breastfed until there was no milk left. They drank it all. And I remember with the first one, my mom said to me, "You stop breastfeeding now because you're going on nights, and how are you going to cope?" But actually, there is a way around that. If you have to go back to work, you can express the milk, and somebody else can feed the baby that good milk that has lots of antibodies. The IgA antibodies are there, ready to go to just protect that child, and also it's been associated with increasing the intelligence of the children, so they're more intelligent when they're breastfeeding. This is all the research. I also did research onto breastfeeding, about breastfeeding, when I was in medical school. It was my final year project as well. So one of the things that Ify have said, I can say that they're definitely true. And all we want to do is let you know and to encourage you. I know there are practical things. So let us talk about, just for a few minutes before we end, what are the practical things? So let's say you've convinced everyone now. So thank you, Ify. You've made us say, look, I want to breastfeed. What have you found are the sort of physical hindrances that will make it difficult when the mom has to stop? There's some patients, they start and they really want to do it. So I really wanted to, but I just couldn't. Talk to that mom there, who has had that, physical problem.
I will say that we would need a part two, because it can become very extensive as to barriers and hindrances to breastfeeding. But I think, so I'll say two of the biggest ones that I've noticed with talking with moms is that it's hard. It's hard and it hurts. And then I always tell moms, breastfeeding should not hurt. If it hurts, something's wrong. And so that in that instance, you know, you have to get help. So seek help. As far as here in the US, I'm not sure how things are over there, but we have breastfeeding peer counselors within the WIC program. And we at hospitals, as you're getting ready and you're talking to your nurse, you're talking to your doctor, your OB, you can really specify and be specific and say, I want a lactation consultant there after I have my baby who's going to help me. We do have baby friendly hospitals. And I say that because they go through this process to be designated as one. Does not mean you, and I'll be very transparent because I don't believe in lying to folks, but being honest that just because something is labeled baby friendly doesn't mean you'll always get that help and support that you need, because individual people, individual nurses, etc. But seeking that help. So breastfeeding should not hurt. And you will need a lot of support. And support I don't mean just within the hospital. That's important. So the lactation consultant or the breastfeeding peer counselor, but support with your intermediate family. So your partner. At times I've heard moms, talk about, oh, my husband or my boyfriend, he wants to feed the baby. He wants to feed the baby, understanding that while mom is with baby, if she wants to breastfeed, she's going to breastfeed. There are no bottles, because there's no need, right? And you have to take out, yes, you'll pump and express at other times, but there will be times for maybe your partner to feed the baby. But food is not love. Food doesn't equal love. It's the connection where you're holding and all of that. So understanding that dynamic too, and having that support, have that supportive partner, have that supportive family members who are going to cater to you, wash the dishes, clean the house while they understand that you're breastfeeding. I think we talked about this before, making sure you have your snack pack next to you, your water, your phone chargers, so that if you don't have to worry about getting up and moving, you're in your place where you can breastfeed. Support is important. So I think that's one of the big barriers, is that some people don't have that support, or they feel like they're like, oh, this hurts and it's hard. Understand that it's a new skill. It's like riding a bike. You're learning, but then also the baby has to learn, and then you both have to learn together. So being patient and giving it that time to be able to learn, and once you do, it'll be a breeze. Because Nonnie, you said you breastfed all 3 of your kids, so like at that point, it's done. It can be done. So it's not something that is unobtainable for people. What was the other one? I would say, I think
that is the main thing. I think it's the discomfort. Some people, they're latching on. And as you say, you just have to learn. So you mentioned the lactational consultants in the States. And here we have the midwives, the health visitor. They're there to help you to learn how to put the baby on the breast and learn how to, I mean, I'm a doctor, but when I became a mother, I had to learn how to do it properly. And I was guided, as Ify said, because I knew the benefits, and I wanted my child to have every benefit going. And so I learned, and you can learn too. And I think that's the point we're making. So don't be put off. Don't think, oh, it's going to change the shape of my breast. It's not. Actually, it's going to give you bigger boobs. This is boob job free. You're going to get enhanced boobs free.
It is true. Yes, they will.
Yeah. So I mean, you don't know. So many things you save on as well, and it also helps with contraception as well. In the first 6 months, if you breastfeed exclusively, you don't need any contraception. 98%. So I mean, there's so many benefits. It helps you to lose all that baby fat as well you've acquired during pregnancy. The list goes on. As Ify says, we're going to need part 2. So while you're digesting part 1, send us your comments. Let us know how you are doing. If this has helped you, if it's been a blessing to you, do share it with someone else. Like, share, subscribe. Tell us our comments. Are we talking rubbish? Should we be resigned back to the Middle Ages? What are these people talking about? What do they know? Well, actually, I've been there, done that, so I know what I'm talking about. So anyway, next time, it's Dr. Nonnie signing out. Thank you for watching.